We stay in the province now. An intern doctor at the Pelonomi hospital in Bloemfontein. In fact, doctors are demanding that the health department expedite the process of beefing up security at the hospital. The doctors, in solidarity with the interns, handed over a memorandum of demands to the provincial Department of Health. This follows an attempted rape of an on-duty intern doctor on Tuesday night. The doctor escaped the rape ordeal when she bit over the perpetrator's tongue. The culprit has since been arrested. We now take the discussion further with the Free State Health Department's HOD Dr. David Motau. Dr. Motau joins me now live from our studios in Bloemfontein. Dr. Motau, good afternoon to you. Thank you so much for joining us. What a horrific incident at the Pelonomi hospital.
Good afternoon to you, and thank you for having me. The incident at Pelonomi was quite horrific, an incident that one would like to forget about as soon as possible, where you've just alluded that one of our intern doctors had an unfortunate situation where an attempt to rape her was made on Tuesday evening. We have since moved with speed as a department to try and address the shortcomings in that facility.
And we know, of course, the perpetrator has been arrested, but this is not the first time that an incident of this nature happens at the very same hospital. In 2010, a doctor was raped by 3 men. So what did the department do at that particular moment to beef up security? 9 years later, we see the same event again happening.
At the time, there was a plan that was put in place in terms of addressing all the challenges that obtained at the time, which was there were no CCTVs, the security was not adequate to can deal with the situation at the time, but all those were implemented. What has happened now recently is that if you go to Pelonomi and the location where it is, you'd find that it's in such a way that the public is moving in and out of the hospital, which is not acceptable. There are about 3 entrances at Pelonomi Hospital, and we have decided that we're going to cut off those entrances. But not only that, we're going to increase the number of security personnel. We've already done that. We're also going to make sure that all the biometrics are in order, in good working condition. But we've also made it a point that if you go into Pelonomi, you'll realize that at night there isn't adequate light to can actually see a person from far. So we've started with the process of installing lights, but most of all we need to also make sure that even at big entrances where the cars are coming in, we need to make sure that there's a security there that is able to check all the cars that are coming in. And we've said to everybody, regardless of who you are, whatever standing you are at, that when you go into those gates, they need to stop you and check you. It doesn't matter whether you're an HOD or you are whoever in the society. So those are the implementation plan that we've managed to put in place this morning. I've said to my staff this morning that I want that to be implemented with immediate effect. Of course, there are other challenges which would then be implemented in the medium term to long term basis, and we'll make sure that we check on that, on a constant basis.
But one could also ask Dr. Motau that did it really have to get to this point before the department could do something? Because some of the doctors that spoke to the SABC were very concerned about their safety. So why did it have to wait to this point before the department could do something? You talk about some security features that were beefed up back in 2010. CCTV cameras were not working this time around.
They were working, but they were not. There was nobody manning those CCTV cameras, and of course we are going to be taking action on people that were supposed to be there. So it's not only about the fact that the infrastructure that is there is not working. It's also about people who in their nature have decided to do things in a manner that is not helping us. And therefore, if those people can be removed and be disciplined, then I'm sure we will be able to have a secure environment in as far as that hospital is concerned.
And who's supposed to take responsibility of what happened? Is it the hospital's management? Is it the department itself?
Naturally, I, as the head of department, I'm an accounting officer of the department. It's in its own entirety.
So you do agree that you failed the doctors who are working at Pelonomi Hospital as an accounting
It's regrettable
officer.
It's regrettable that this incidents happened, but I was going to still continue to say each facility has a CEO that needs to make sure that CEO is an accounting officer by their own right. Now, they have to make sure that their facility is safe for everybody, not only the doctors, but also the patients themselves that are coming into that facility. So the CEO, yes, has failed, but I take overall responsibility as the head of department.
All right. So will there be any measures, perhaps disciplinary measures taken against the CEO, as you say he's failed?
Yes. As I said earlier, we have instructed the CEO that there should be consequences in as far as who shall have dropped the ball or failed us, in terms of making sure that these things that are supposed to happen are happening, failing which he is going to have to bear the brunt.
All right. Has the department engaged with the doctors working at that hospital? And what sense did you get from engagements with them?
I had a meeting with the doctors this morning. I'm sure you are aware that there was a demonstration in front of the hospital where they demanded to meet with the management of the department, and I went there myself to engage with them. And I've outlined my plan in as far as that hospital is concerned. But I must also say that, I must also indicate that it's not only Pelonomi that has issues, it's all our hospitals in the province. And it's not only this province that has issues, it's all other provinces out there. You'd remember that in the recent past there was an incident in Limpopo where the minister also, the then minister also intervened in that regard. So security issue is not an issue that is only in the Free State. It's a countrywide issue which we have to deal with and make sure that we combat that issue as far possible as we can.
Do you have the necessary financial resources to look into this issue? As you say, it's not just Pelonomi, but the rest of other health institutions in the province.
We don't have the necessary resources in terms of finance, but I said to my CFO this morning that we'll have to look at reprioritizing in as far as that is concerned. Should there be any measures that we need to put in place that would have financial implications, we'll have to reprioritize without necessarily compromising service delivery in as far as our people are concerned.
Dr. David Motau is the head of the department or the Department of Health in the Free State, joining us now live from our studios in Bloemfontein. Thank you so much.